Child and Adolescent Mental Health Nursing. Unit 1, Module 6, Trauma-Informed Care, Translating Science into Pediatric Nursing Practice. We now understand how early experiences shape brain development. We understand stress, resilience, and adversity. Now the question becomes, what do we do with this knowledge? Trauma-informed care is how we translate understanding into action. Trauma-informed care begins with a shift in perspective from what is wrong with this child to what has this child experienced, and just as important, what does this child need right now to feel safe? Trauma-informed care is guided by principles identified by the Substance Abuse and Mental Health Services Administration, SAMHSA. These include safety, trustworthiness, collaboration, empowerment, peer support, and cultural humility. These principles guide every interaction. Children affected by trauma are highly sensitive to unpredictability. Nursing actions that increase safety include explaining what will happen before doing it, using calm, consistent communication, avoiding sudden touch, creating predictable routines. A dysregulated child cannot learn or cooperate. Regulation comes first. Trust is built through consistency, following through on what you say, and having honest communication. Repair when mistakes happen. Small moments matter. Predictability helps lower threat perception. Trauma often involves loss of control. We restore control by offering choices. Do you want to sit here or here? Which arm would you like me to use? These small choices reduce stress and increase cooperation. Children with chronic illness or repeated procedures may experience medical trauma. To reduce retraumatization, prepare the child in advance. Allow caregiver presence when possible. Use simple, honest explanations. Offer breaks when appropriate. Minimize restraint whenever possible. Behavior during procedures is often a stress response, not defiance. Caregivers may also be overwhelmed or experiencing their own stress. Approach with curiosity, not judgment. Instead of asking, "Why didn't you follow through?" ask, "What barriers are making this difficult?" Support the caregiver-child relationship. That is the most powerful intervention. Clinical judgment in trauma-informed care. Case: a 9-year-old becomes increasingly agitated during a routine procedure. Recognize cues: escalation, distress. Analyze cues: possible trauma response. Prioritize: emotional safety before task completion. Generate solutions: pause, offer choices. Involve caregiver. Take action. Use calm, predictable communication. Evaluate: does the child regulate and tolerate the procedure? Trauma-informed care does not require perfection. It requires awareness. When nurses promote safety, restore control, strengthen relationships, and reduce stress, we are not just managing behavior. We are protecting the developing brain.